Welcome back to the third year of medical school lecture series. Now today we're going to discuss how to effectively and strategically present a patient. We'll discuss what's known as the SOAP format: subjective, objective, assessment, and plan. If you learn this SOAP format properly, you'll always be able to successfully present. Now, what is presenting a patient? In medicine, patients are presented. It's an international and organized way in which we present complicated problems to each other regarding patients. Presentations are quite formal, and they always follow the same format. This is known as the SOAP format. Not the kind of soap you wash yourself with, but it's just SOAP stands for subjective, objective, assessment, and plan. There is really quite a skill that you need to master for the SOAP format, because strategically presenting is kind of what you need to do. You don't present every patient the same way. You need to present strategically based on your audience. And this is a skill that you will master over time, and the sooner you learn how to play with your SOAP presentation based on your audience, you're going to look as like a rock star as a third-year medical student. Also, following the SOAP format always gives you a great foundation for developing and growing your presentation skills. So let's talk about the SOAP presentation format. Now the S in SOAP stands for subjective. What does that mean? The subjective is where the complaints of the patients go in their own words. You have to write down, or type nowadays, what the patient is complaining about or concerned about in their own words. This is why it's called a subjective, as it's subjective information given to you by the patient. Here's a quick example. The chief complaint falls under subjective, right? And you should not write UTI under the chief complaint. What you should write is whatever the patient said. When you say, "What brought you in today?" and they say, "It burns when I pee," you should write "burning with urination," or if your attending prefers, "It burns when I pee." Whatever the patient said, that's your subjective. It's your chief complaint. Now, when you're presenting a new patient in this SOAP format, the subjective is going to include the following. It's going to include the chief complaint. That's what the patient complained about. It's going to include the HPI, or the history of present illness. This is when you ask all the questions regarding the chief complaint. It's going to include a past medical history, a past surgical history, their medications, their allergies, their family history, their social history, and also their review of symptoms. Now, for the history of present illness, ensure that you include the following characteristics for the patient's chief complaint. Whatever their problem is, for the most part, you should be including these variables. The onset of whatever their problem is, the location on the body where it is, if whatever's bothering them radiates, the duration of how long have they had it. Has it been an acute thing for a short period of time? Is it subacute? Is it subacute on chronic? Whatever it is. The character, how would they describe it to you? The quality, the severity of what they're complaining about. Does anything make their problem better or worse? Have they ever had previous episodes? Are there any associated symptoms? And why they came into the hospital or clinic today? And that's a key point. The why they came in can be a confusing thing for new students. And they may have a tough time trying to ask that question, or know what information they're trying to pull. The key is, problems will sometimes be super acute, and it makes sense why they came in. The pain started 4 hours ago, it was too much to handle, I came in today. Okay, that's why you came in. But sometimes problems can be longer duration, and something may have tipped the patient off to come in today as opposed to, say, a week ago. That's what you're trying to figure out. If the problem is older, why did they come in today? What made them say, you know what, today is the day I'm going to get help from a doctor? So that's what that one question means, why they came in. So that follows the subjective, all the information you're going to gather from the patient. The next section in the SOAP format is known as objective. This is where you have the presentation of numbers and objective data. This will include, but is not limited to, the vitals, the laboratory values, the imaging results, any procedures or things done. This is an objective thing. The sodium is 138. The potassium is 3.6. The imaging chest x-ray showed this consolidation, or whatever. It's just objective facts that you can see. So that falls under objective. The next in our SOAP format is the A, or assessment. An assessment is where you give a one-liner for what you think is going on with a patient. An assessment really is, what do you think is going on? Here's an example of an assessment. This is a 45-year-old female patient who presents with 3 days of burning urination with a history of multiple UTIs and pyelonephritis, who presents today with another episode of a UTI, period. That's an assessment. Who's the patient? What's relevant background info? Why did they come in? And what do you think is going on? The assessment could be the patient has any problem. We just need to know in your assessment, what do you think is going on with the patient? And if you actually think about the organization of the SOAP format up until assessment, the organization actually makes a lot of sense. Subjective starts first. What is the patient complaining about? Objective, what lab or numbers do you have to correlate with that? And with those pieces of information, what is your assessment? What do you think is going on? And that's a pretty logical way to go. And the last part is the plan. Now that you have an idea of, well, this is what I think is going on, what do you want to do about it? And that's what the plan is. It's where you then present all the problems the patient has in a system or problem-based format and your plan for each one. So in that example we gave of a patient having a UTI, the first problem would be urinary tract infection. And you need to write, what do you want to do about it? Give fluids, give antibiotics, what's your plan? Admit them to the hospital? So really, the SOAP format is very logical. So, information above, your assessment, and then what do you want to do about it? Now, the SOAP format then is really quite easy to understand. And the purpose of us mapping it out as we did was we can create a mental pathway in our head. Whenever you're presenting, always tell yourself that if you start with the subjective, you then need information to go on to the objective. You need numbers. And then once you have the personal complaints or the subjective, you got the data from the numbers in the objective, then you need to give me a one-line assessment of what you think is going on, and then what do you want to do about it? And this is very logical. We always gather information, come to some conclusion, and then have a plan. That's all the SOAP format is. But with this simple framework in your mind, whenever you're presenting and someone interrupts you, and I guarantee you people will be interrupting you as you present because people will have questions. So they'll be like, hey, that didn't make sense, or what do you think about that? Then what you can deal with the question, and you can always go back to where you were in your mind. I was in the middle of the objective. Here's where it was. So if you know the SOAP format in your mind, you'll never lose your spot in the presentation. Also, when you're presenting complicated patients that have multiple things going on, you can always ask yourself, okay, this patient's got a lot going on, I'm kind of overwhelmed, hold on a second. I can always think about the SOAP format. Their problems, their complaints are here. Organize it in your mind. The most complicated patient should always be able to be presented efficiently and quickly using the SOAP format. So always follow that mental model in your head. And really, sticking to this format will make your presentations appear much more focused and organized. The worst thing that happens during rounds is to listen to a disorganized presentation. That is essentially nails on a chalkboard to us. Even if what you're saying is accurate, if it lacks the organization of the SOAP format, it will disturb the listeners, and then your presentation is going to be seen really as bad or even horrible. And that follows like on a concept of emotional intelligence. If you know that the SOAP format is how everyone presents patients in the world, you better follow the SOAP format, because if you don't, you're going to make people feel uncomfortable, or something new is going to be presented to them that they won't like. So follow the SOAP format and you'll always sound much better and your presentations will be stronger. Now, the strategy behind utilizing the SOAP format is really based on your audience. You should always think, who am I presenting it to, and how can I tweak my presentation to accommodate them? You're always going to use the SOAP format, but sometimes we do need to make some tweaks. So, sometimes you'll be presenting to an attending. This is usually who you'll be presenting to, and this is usually your audience. And it can be sitting down, it can be relaxed, and you can give your entire presentation to the attending. Most academic attendings allow this. It's sit down, it's calm, you present the entire thing, and they may or may not interrupt you. But there will be other times that you'll notice the attending is in a rush, and they just want to hear the highlights. Now, this is a challenge for most third-year medical students. Most third-year medical students that I've seen are pretty good at giving a lengthy, exhaustive SOAP format presentation. They'll talk for over an hour if I let them about a patient. But that's not too hard to do. It's easy to map out the SOAP format and just put everything in there. But if I'm in a rush, or if the attending says, you know what, let's go a little bit quicker on this one, that's when most third-year medical students start to panic. They're like, whoa, how do I shrink all this down? Well, if you stick to the SOAP format, you can actually do this. So the secret to being able to accommodate any of the requests is to always think about the SOAP format in your mind. If you have to give an abridged or a shortened presentation, you can just go through each section of the SOAP format, the subjective, the objective, the assessment, the plan, and think, okay, what was in the subjective? What are the highlights or the pertinent positives for each section? You can say, okay, here's the really important stuff for subjective. That's what I'm going to tell him. Here's the really important lab values under objective. Here's what I'm going to tell him. Here's my assessment that he cares about, and here's the parts of the plan that he's going to care about that I'm going to give. So in that way, you can still use the SOAP format, but say, okay, where are the pieces of gold that I need to take out that are the highlights to give a short presentation? And that works really well because you're still always saying to yourself, stick to that mental framework or the SOAP format and I'll do great. Sometimes I've seen third-year medical students where we say, you know what, give us a quick presentation on this guy. We don't have an hour to sit down. And students just start to rumble and mumble and they don't even know what they're saying. But if they were to slow down and say, you know what, let me stick to my SOAP format. Let me just pull out the highlights for each one. They'll do great. So make sure to stick to that mental framework. What you also need to make sure is that you thoroughly prepare for your presentations. Presentations really are the method by which you're evaluated and also graded by both attendings and residents. If you present confidently in an organized manner, calm, and things are put together, you will look even smarter. Even if you don't know all the details, but if you took time to read and organize your SOAP format and you present confidently, you're going to look like a star. And that's what you want to do as a third-year medical student. You want to give the appearance that you're doing well. And of course, if we see that you're doing well, you're doing a great job. You may feel like, well, I'm trying to look good, but if you're looking good, I guarantee you, you're doing great on the inside as well. Now let's review what we've talked about. When you're presenting a patient, always plan out the presentation in your note and in your mind following the SOAP format. Think about your audience when you're presenting and plan accordingly. Use emotional intelligence to tell you how much detail to cover in the presentation. Is there lots of time, or do you need to prepare or present more quickly? Prepare for your presentations and take them very seriously. They're the method by which you're graded and evaluated as a third-year medical student. Thank you.